Good morning, everyone. I'm pleased to be with you today, and we have quite a large group of people who are participating, so thank you for tuning in here. I'm glad to be presenting to you this morning on integrating tribal child welfare and with a system of care philosophy. This presentation is hosted by the National Indian Child Welfare Association as a partner with the National TA Network, and it's operated in coordination through the University of Maryland, funded by SAMHSA's System of Care. The learning objectives today, we want to go through and talk about the fundamentals of tribal child welfare, look at some models and services, a range of services. Well, you should, at the end, should be able to discuss the relationship between trauma, child maltreatment, and mental health. And for those of you in system of care communities, how to engage tribal child welfare programs in a dialogue with regard to system of care approaches. We'll get right to it. One of the big questions, just to set the context for this presentation, is to discuss what is tribal child welfare. One of the challenges of a discussion like this is that tribal child welfare looks different in different parts of the country and different states. But virtually every tribe in the nation has a child welfare program of some kind. I'm going to talk a little bit more about what they might look like. They vary in size across the country based on the size of the tribe and jurisdictional issues and funding and capacity issues. Tribal child welfare ranges from being a full range of child welfare services to simply providing advocacy for tribal children in state or county systems. In a minute, I will be talking about what that full range of services might look like. I'd like to note that sometimes there's confusion because of labels of what is an ICWA program and what is a tribal child welfare program. In most places, those two things are synonymous. In some places, the ICWA program only deals with enforcement or implementation of the Indian Child Welfare Act and dealing with cases that are being handled by the state or county system. And just also to give a little more context here, tribes run their own child welfare system because of tribal jurisdiction. Tribes retain from time immemorial a civil regulatory jurisdiction. That means governing the relationships between people, and that includes the relationship between parents and their children, and can set standards for how children should be treated and make sure that children remain safe. The Indian Child Welfare Act, that was passed in 1978, affirmed that jurisdiction. It recognized the tribe's sovereign right to operate child welfare programs, as well as setting up regulations that states and counties have to follow. So that the scope and issue in the design of child welfare on a local level is really up to the tribe. So given that context, I want to talk a little bit about what is the full range of child welfare services. Quite often, there's a misperception that child welfare is simply the protective function. In other words, the investigation of child abuse, neglect, and the placement of children. When in fact child welfare ranges all the way from the preventive services, making sure that families have their basic needs met and have supports. And all families need those basic supports. There are a number of tribal programs that actually help support the welfare of children that are not often labeled as child welfare. So, for example, a TANF program may be doing child welfare functions, sometimes in collaboration or cooperation with the child welfare program, but certainly meeting the needs of families. There are supports for families who are at risk. Some families need more services than others, and when there's a specific challenge in the family. Some families require in-home services, and sometimes these are referred to as family preservation programs. Not always, but these are families that have been identified where a child has been maltreated or is believed to be neglected or suffered some form of abuse. But they can remain safely in their home because there's enough eyes and ears in the community and in the child welfare system to make sure that children can be kept safely in their own homes. Optimally, this should be most of the cases in a tribal child welfare program. The next bullet, the child protective services, these are what's classically thought of as investigation of child abuse and neglect and the determination of whether or not the abuse actually happened, and then a plan to place and involves court action. The bullet before, the in-home services, may or may not be ordered by a court, may be voluntary services by a family who's identified as having some risk. And again, these happen differently in different places. The next bullet is substitute care. When children can't stay safely in their own homes, being placed with relatives or in foster care, and sometimes in group care. These services are designed to be temporary with plans to help families be safe for children and for children to be returned. So the next bullet is the restorative and the reunification services. And finally, the last bullet is permanency. The best form of permanency is always children being able to grow up safely in their own family, and if not with their biological parents, with members of their own extended family. But permanency really refers to a sense of belonging over time. And the more you can keep children connected with their reference points for belonging, the better the outcomes for children. When children can't be raised in their birth families, guardianships and adoption or customary adoption are different ways to achieve those permanency outcomes. So today, given that overview, I want to draw a connection between trauma, child abuse, and mental health. And this cycle that I've labeled a collective trauma cycle is an example of how historic trauma can contribute to personally in the dynamics or the issues of a particular family. So if you take the boarding school example historically where many children were abused, certainly experienced loss from being separated from their families and experienced threatened attachments, not having nurturing adults and relatives in their life if they spent, and many people spent from the time they were 4 or 5 until they were 17 or 18 in boarding schools. You don't learn to parent. You don't learn how to live in the context of family. So that experience can result in a lack of parenting skills and a lack of social norms that contribute to effective parenting. So ending up in removals of children, added to that a collective trauma of unnecessary removals that were both historic and current when children are removed because of their the implicit bias of the system in treating families unevenly. These all represent loss and victimization that that creates an environment of complex trauma with the resulting mental health issues of depression, anxiety, substance abuse, and many others. This is a cycle that I'm going to talk more about. Particularly, we're going to talk about adverse childhood experiences. We're going to look at these this cycle as both historic and collective, and I'll draw the links between historic and collective trauma that's passed through generations via the adverse childhood experiences to the conditions that we see today. But more importantly, I want to talk about how this cycle can be overcome. Just a bit about the historical trauma. It is a collective trauma. It's a trauma that's passed through generations. The pervasive loss of people, land, food, water during the period of military conquest and westward expansion, things like forced assimilation with removal of kids to boarding schools, the urbanization and relocation, things like termination and allotments, the Dawes Act, it was also known as the Allotment Act, creating the process of understanding citizenship by a blood quantum. All of these historic factors represent collective trauma. I also, before we leave this slide, I want to acknowledge the work of Maria Yellow Horse Braveheart and Bonnie Duran and Teresa Evans Campbell and many others who have written about this historic intergenerational trauma and how important it is to understanding mental health today, because these intergenerational traumas manifest in addiction, abuse, many mental health issues, suicide attempts, the absence of parenting knowledge and skills, the loss of cultural identity, the loss of children, loss of family integrity. And so the one historically, as our native scholars have written about this work, one of the things that's been called into question is how does this historic trauma transfer? Because we see the impact on our children of historic and intergenerational trauma. We see it today as complex trauma because people are victims of violence and sexual assault, emotional abuse, bullying, separation. We also experience it by seeing it as bystanders, watching so much loss in our communities, and our children experience it by witnessing violence. So, and we experience the chronic trauma that comes as a result of poverty and discrimination. And as helpers, we all experience secondary trauma as we try to help those who suffer with these conditions. Again, trying to understand how is this transmitted generation to generation. Well, one of the things that has really helped, I believe, helps us understand the transfer of trauma from generation to generation is the notion of adverse childhood experiences, the the ACEs studies. The adverse childhood experience studies were conducted looking at over 20,000 individuals. They were looking at, this is Kaiser Permanente and the Centers for Disease Control, trying to understand if there were common factors associated with early death. And this study was originally published in 1998 by Folletti and others. And they identified originally 9 and more recently added a 10th. Recurring physical abuse, chronic emotional abuse, contact sexual abuse, alcohol and drug abuser in the home, incarcerated household member, someone who's chronically depressed, mentally ill, institutionalized, suicidal, a mother who's treated violently, a loss of one or both parents, and emotional or physical neglect. These factors increase the risk of negative health outcomes. And in the ACEs study, an ACE score is a count of the total number of adverse childhood experience indicators for an individual, and they range from a score of 1 that's associated with low trauma to a score of 9 indicating high degree of trauma. And in the mainstream population in these studies, an ACE score, as the ACE score increases, the risk of numerous health problems, including early death, increases. And you can see it on this chart. So adverse childhood experiences contributing to social, emotional, cognitive impairment, the adoption of high-risk behaviors by individuals, leading to disease, disability, social problems, and early death. So the question that these studies and this publication was going on about the same time as our Native scholars were identifying historic trauma and its impact on our children and families. So many scholars began to draw the link and ask the question, are these two things associated? Does the adverse childhood experiences study explain some of what we see in our communities? In 2005 to 2010, I believe it was, the NICWA and several partners, including the Prevent Child Abuse America and Purdue University, conducted a study called the American Indian Youth Victimization and Delinquency Outcome Study, funded by Department of Justice. And this was a participatory research model. Youth helped us make up the questions, and we administered it through a online process. And the young people who participated were 18 to 24, and largely pretty functional kids, because we started with young people who were on advisory committees, who were in tribal colleges, and they recruited their friends. One of the most dramatic findings, even in this population of Native young people, it was 110 young people, a mix of young men, young women, reservation, rural, urban. We found that 25% of the sample had experienced 4 or more adverse conditions, and that those adverse conditions were associated with substance abuse, depression, and suicide attempts. So that's a pretty dramatic finding. We wondered, are others finding similar results? Well, in a study by Brockie, he found that 23% of Native youth experienced 4 or more ACEs, very consistent with our findings. His population was a bit younger than ours. And he also found a significant impact on 4 outcomes: suicide, polydrug use, post-traumatic stress disorder, and depression. We also we see the results in several other studies. There's a study by Duke looking at over 100,000 youth, almost 2,000 of them American Indian or Alaska Native. And in that study, American Indian and Alaska Native were more likely than any other population to experience at least one ACE. A study by Koss found that 3/4 of the American Indian and Alaska Native people in their study were exposed to ACEs, and there was a high correlation with substance abuse. And still another study found, 2 more studies found that 75% of American Indian and Alaska Native men and women, so 3/4 of them, had been exposed to ACEs. And those of that group that had 4 or more were 7 times more likely to attempt suicide. So the impacts of this are likely to continue from generation to generation if we don't interrupt this cycle. Unfortunately, the mainstream models of child welfare are culturally bound. They're designed for a culture of individualism, and historically were created based on a model of rescue, protection, and policing. So the very first child abuse investigations were done by the ASPCA in New York City because there were no child abuse laws at the time. This system still today primarily relies on removal of children from their homes. And it places the responsibility on individual parents to change the conditions. So they're given a case plan and expected to make those changes in order to get their children back. It assumes that the parent has the tools to be able to change those conditions, and it expects families to engage the system basically on their own. So it leaves families with a set of conditions they have to meet to get their children back. Unfortunately, services that rely primarily on removal and don't recognize this the cycle that we've just talked about run the risk of perpetuating and compounding the trauma rather than interrupting the cycle. In our indigenous families, and I use that term because this work is international, so in the United States and Canada and Australia, New Zealand, the overrepresentation of indigenous children in out-of-home care is primarily related to poverty, poor housing, poor education, untreated mental health problems, and caregiver substance misuse. You can see that the results of historic collective trauma handed down generation to generation through the process of adverse childhood experiences result in exactly the conditions that are contributing to the overrepresentation of our children in the child welfare system. This, the history has produced a cycle of trauma. question is this a setup for failure? Are these problems that families can solve themselves? If the problems that contribute mostly to removal are poverty, untreated mental health problems, caregiver substance misuse, that are part of this cycle of historic trauma and adverse childhood experiences, will a case plan expecting the parent to act on these problems will they be able to resolve these issues? The likelihood is not. Now, I want to make very clear that what I'm saying does not diminish the need for parents, for people to take responsibility for what they can change. And so treating parents with compassion and not establishing or not promoting dependency is important. But it is important to have a child welfare system that is responsive to the needs and of people who have lived experience in this cycle of trauma. I want to tell you about, and some of you will be familiar with, the touchstones of hope. In 2005, at an international convening at Niagara-on-the-Lake in Ontario, Canada, 220 people gathered. 100 of them were in First Nations and American Indian Alaska Native from Canada and the U.S. Another 100 were non-Native child welfare professionals, half from the U.S., half from Canada. The other 20 were people from international settings, from Central America, from New Zealand, from Australia, and most importantly, from South Africa. And NICWA was a co-sponsor of this event, and the delegation from South Africa led us through a process of truth, healing, and reconciliation. And the objective of this 5-day event was to tell the truth about what child welfare has done to our peoples in the course of this historic trauma, and to try to define together a new form of child welfare service that could be effective in healing historic trauma and moving tribal child welfare into a new era. It is based in 5 main points. This is published in a document. Cindy Blackstock from Canada is the lead author. And the 5 bullets are self-determination, culture and language, holistic approaches, structural interventions, and non-discrimination. We're going to take a look at each of these. This notion of the touchstones is based in the notion that our tribal communities, wherever we are, cannot afford to lose one family, and that safety of a child is dependent on the safety and well-being of the entire family. And so it isn't just a matter of putting conditions on the family, but helping a family learn to create and structure a safe environment for the child to resolve the historic trauma issues, to heal their current and complex trauma if possible. Now, not all families can do this, but many, many can if the services engage the family rather than expecting the family to engage the services. It assumes, this touchstone model assumes that the family, including the extended family with support, is a better parent than the government, any government, whether that's county, state, provincial, or tribal. It requires that the system engages the family in a partnership of healing and empowers the family to provide safety. It's trauma-informed, and it's safe, and it's focused on safety and well-being long-term. Self-determination says that each community is in the best position to know what's best for them, but it is essential that we embrace what hurts and take ownership. No one from outside is going to solve these problems. They have to be solved from within, and that means making sure that we talk about it, that we help one another. It has to be linked with everything from economic development and protecting our lands and our water, and associating that closely with child safety. It means that we have to be engaged constantly in the process of reconciliation with child welfare programs, and to make sure that leadership is engaged in this work. Culture and language is essential that we have clarity about the community's child-rearing knowledge, and that the community participate in the standards for what it means to have safe children, that our indigenous knowledge about what is good parenting is the best guide for us in child welfare. It acknowledges that mainstream child welfare is culturally loaded, that it is, in other words, it's designed to do what it was designed to do culturally, which was encourage individuality, and does relies on that separation, and that may or may not work in the mainstream society, but it's certainly not healthy to approach the work in that way for a community that has been devastated by historic trauma and the trauma cycle that we've outlined. And it doesn't work very well to just use mainstream services and try to adapt them into our communities. We have to come up with our own solutions. So we need holistic approaches. Community planning is central. Youth and family engagement is essential. We need to be cautious about doing our services only in the form of what's fundable by the government. These are decisions that we should be making locally, and to the extent possible, engaging a wide degree of partners, including the nonprofit sector. Structural interventions are essential, so dealing with the issues of poverty and employment and mental health and substance use has to be integrated throughout the child welfare service approach. Non-discrimination, making sure that our families receive adequate services and that our indigenous knowledge about the well-being of families is put on equal footing as the mainstream, and promoting respectful relationships across cultures, across jurisdictions, with open communication and support. We have to be able to interact with others outside, but need to make sure that equitable treatment is the hallmark of those relationships. I want to give an example of this, and it is happening in many different parts of the country. There's something called the WIPIC project, the Western Pacific Implementation Center project. It was funded by the Children's Bureau, and it involved 16 Native tribal partners representing more than 100 tribes. It was developed by the tribes, and was a proposal to the Children's Bureau in response to the disproportionality of placement in Alaska. At the time, Native population represented only 17% of the state, but over 60% of the foster care population. The project was to increase the tribal capacity to provide services and build a new relationship and systems that could be responsive to families based on this knowledge of historic trauma. So that these tribes came together, created standards based on a safety model. Their objective was to structure safety instead of intervening with protection. So the more that you could structure the safety around a child and in many communities not wait for bruises or not wait for abandonment, but to intervene early. They developed a system of care model in which they would implement 8 core elements in the framework of a system of care of coordinated services with collaboration across the systems, so that they could, in small communities, have enough eyes on children to make sure they could be safe in their own homes, if at all possible. Here's a picture of what that system, the standards that they created. This model would link together parent support and healthy relationships, addressing sobriety and domestic violence, relying on cultural strengths and basic needs, teaching life skills, all aimed at help creating safe spaces for children, and that all service providers in the environment, the courts, the state child welfare services, the court-appointed special advocates, health care, behavioral health, TANF, and cultural resource, all would be part of that system of care. First step was to meet in communities to review and provide a foundation for redesigning child welfare to support families in need, to change the way that communities thought about from a model of protection coming in from outside, from the state, to safety being built inside through self-determination. First, the question, second step was to discuss and brainstorm and have group dialogue and answer the question, what's a safe child in your community? And only by creating these local definitions of safety and then structuring a response to how we help every family in the community be safe, could they come to a model of agreement. The third step was to actually then begin staffing cases to reveal the services, because the myth was, particularly by outsiders, that there weren't enough services in the villages to keep children safe. And you can see from these diagrams, they're pictures of the whiteboard diagrams that we drew on individual cases and learned that, yes, indeed, there were resources in the community. They were not many of the resources that outsiders would think, and so many of these were volunteers, extended family members, family advocates, people who would step up and be part of this system of care to help children be safe in their community. And I have one community in the Bethel region that has not had a placement outside of their village now in 8 years. So what is a system of care approach? Well, I wanted to just share with you, particularly those who don't work in the system of care arena. This is adapted from the SAMHSA's definition that was written by Beth Stroll and Gary Blau and Robert Friedman. So we've adapted it to a child welfare definition. System care is a spectrum of effective community-based services and and supports. The important word here is supports for children and youth with or at risk of child maltreatment and their families that is organized in a coordinated network, building meaningful partnerships with families and youth, and addresses the cultural and linguistic needs in order to help them function better at home and in school and the community and throughout life. And to function better means to be safe. It also means to interrupt this cycle that we've discussed with its growing from the historic collective trauma to the individual adverse childhood experiences. So we're going to use this the chat box to have some discussion questions. So I'm going to ask for some representative examples here. What is a safe child in your community? What does it mean for children to be safe in your community? Go ahead and let's see. Someone asked for the slides. Yes, you can click on the file name and download the file. So the question on the table here is, what's a safe child in your community? So Rose says that to be able to go to school without being bullied. We have others are typing. We have multiple attendees are typing. Great. This is a great question to discuss in your community. If you have a governance committee in your system of care, asking this. So Sabrina says a child that is safe at home from physical, emotional, and sexual abuse. Janice is living with supportive family and relatives that allow the child to grow and to thrive. This starts the conversation about child welfare from a very different place than the discussion about laws and what isn't okay. And this starts the conversation at a place of strength. So Vanessa says a child that is loved and protected by their family and their school and their friends. So these are, this is typical of the kinds of discussions we hear in communities. And then we can ask the question, how do you get there? Every child deserves safety. And if every child deserves safety, then you need a child welfare system that is defined much more broadly than a system that simply intervenes when something goes terribly wrong. So the next, Tristan, the child who's supported to attend cultural community events and practice their culture. I want to move to the second question. Who's responsible for child safety? Who's responsible for the safety of children? And we have several people typing. Thank you. Who's responsible for the safety of children? Rose is all of us relatives in the community. Again, that's a different approach to child welfare. Janice's parents, grandparents, community, leaders, and Ashley, teachers, school, parents, churches, community members, shared responsibility of those in the child's environment. Sabrina says everyone. Well, that's exactly right on. When we do this exercise in community, when we ask this question, I followed it by who's responsible for child protection, and everyone but just by asking the two questions together, people realize that if you separate out child protection from child safety, you've compartmentalized it in a way that is not serving the community, especially if you vest it in the hands of a county or state and somebody outside of your tribe is responsible for protection. So rethinking child welfare to be about the safety of all children means that we begin to structure for safety instead of intervening so much on protection. Now, I want to also say there are bad actors out there, and we will always have to protect children from the bad actors, but we can cut way down on the number of children who have to be removed from their homes if we increase the responsibility across the system for the safety of children. So we also use this question, prior to colonization, how were children kept safe? How were children kept safe prior to colonization? Because we didn't have much child abuse in our communities at the time. You can begin to understand this cycle of historic and collective trauma as expressed today through the adverse childhood experiences, that we now have a problem that we didn't have long ago. So how were children kept safe prior to colonization? Again, we have several people who are typing. Before colonization, our children were cared for by the community. Abusers were shamed in public and by the whole tribe. That's right, they were ostracized, they were kept out. We had strong norms, we had strong cultural values about how children should be treated. We had strong spiritual teachings, and we had cultural practices to help mitigate the impact of trauma. See, it's not that we didn't have trauma in our communities, but the trauma was not pervasive. It was not the widespread intentional infliction that came with colonization. So children were considered sacred. Harmony says the whole community participated in rearing and protecting our children. Thank you for that. These are important concepts that as we begin to heal from this intergenerational trauma, that all of us are responsible and participating in child rearing and the safety of all children. I was just in a community in British Columbia a few weeks ago, and there's a community panel of 7 women who have created a child welfare system that is using the safety system. And they're not, none of them are child welfare workers. The child welfare system is still the province outside. But this community of 750 people only have 1 child in foster care because they are reinstituting the responsibility of their community. And when they see a child in need, they were giving me an example of a child the prior weekend who had been at a community event that didn't have adult supervision. The clothing was tattered, the child was dirty. But rather than call child protection, members of their committee knocked on the door of the grandfather and said, "Is everything all right? We see a child in need, and this tells us that somebody's suffering, something's going on. How can we help?" A very different way to handle a child welfare concern, not out of calling an institution to come and protect and probably remove but to be compassionate and loving and caring and helping, being that community that helps people in times of need, seeing children who are not getting adequate care as indicators of something that needs to be addressed in the community and in a family. So next bullet, what behavior regarding children is not acceptable in your community? This gets us to the standard setting. It's so important every community set their own standard of what is and isn't okay. This is an important question, important conversation to have with tribal leaders. This past spring, Nick was able to work with the tribe in Washington and spent many hours with the tribal council answering this question so they could examine what they wanted their child welfare system to be in their tribe. Objectifying children is not acceptable. Abuse in any form. So I've asked this question in tribal communities throughout the United States, in Canada, and I've had a chance to do it in Australia. And I have never been in a tribal community that wasn't able to answer this question and be clear about what the standards were. And so our communities know how to do this. So then I asked them, can you imagine a map of service providers, community members, who can watch and support and help? What would that look like? And this is you saw the results of this exercise in the WIPIC project in Alaska, beginning to map out who in your community can be part of this network for child safety, not having child safety be reliant on any one entity, especially an entity from outside the tribal community. Well, this question is more rhetorical. Let's move on. I want to take a look at how child welfare is being expanded in the system of care communities, and how we might think of this in our work with families and with in our SOC projects. So clearly the expansion of trauma-informed services is essential. It is, the more informed we are about the historic and collective trauma, its impact, and the transfer from generation to generation through adverse childhood experiences, the more people begin to understand that mental health and child welfare have to work together. It is essential to interrupt the cycle, and neither of the problems will get better unless we work together. We need each other, and we need the other elements of the services as well. I just want to acknowledge that Rose said that in response to the last question about imagining a map of service providers, it's a circle of care. It's the school, it's the grandparents, it's the local committees. It is so this expansion of being trauma-informed throughout all of those entities that touch children, it augments the prevention capacity. I have begun to believe that the services that we're talking about, well, some people compartmentalize them into to say, oh, that's prevention. I think that in actuality, it's much more than prevention. It's when you know the trauma exists, to the extent that we know it exists in our communities, when we begin to act as our ancestors taught us to to be with other people in good ways, with gratitude, generosity, compassion, respect, harmony, and all of the things that in my Seneca traditions we call the good mind. That's not just prevention, that's healthy living, that's therapeutic, that's healing in our communities. So we need to not only respond to, in mental health, to the trauma of maltreatment, but to the traumas that may have contributed to the maltreatment. And we need to respond as well to the history of trauma of removal. Not this summer, but the summer before, I was pleased to be part of a project at Sinte Glasgow with with Marlise and one of her one of her student interns, as well as with First Nations Repatriation Institute, a series of focus groups with family members who had lost children to the child welfare system. And what became very clear was the collective trauma of relatives, aunties, uncles, grandparents, the birth parents, the cousins, the brothers and sisters, of the people who were lost to the system. The ache, the pain of loss of children to the system is pervasive, and it contributes to those ongoing adverse childhood experiences. So one of the major things for our system of care programs to respond to is the trauma of removal when families are disrupted, where placement has to happen. And making sure that children are with their extended families and minimizing the degree of separation. This is why the Indian Child Welfare Act was passed, and why we have to create and reinvent our systems to make sure that we begin to cut down, to interrupt that circle of trauma. We do that through a process of screening and assessment for mental health needs in all of our child welfare cases, in close partnerships, so that children and families are getting the help with all of the issues that they carry. And I think it's important to acknowledge that trauma is not something that's wrong with people. Trauma is something that happened to people. People have the right, the birthright, to be happy, healthy, and whole, and trauma can be healed. People are vital, valuable human beings that bad things have happened to. That trauma can be healed. So engaging in partnerships to bring system of care thinking to tribal child welfare can help spread this notion and bring the healing in a inclusive, collective sense. It's not necessary for people to continue to have to suffer with the afflictions, and we can begin to reduce and mitigate the impacts of the adverse childhood experiences. I just want to, I mentioned Sinte Glasgow as an example, but in preparation for this webinar, I asked Marlise about their work with child welfare. And their system of care they refer to as a society of care. It's a society care for the welfare of all children. And it's about trauma being transformed. And I just heard a quote this past week, in doing some racial healing work. The quote was, trauma not transformed is trauma transferred. In other words, if we don't do the healing work that's necessary and with regard to trauma, we will transfer it from generation to generation. So we have to be trauma-informed. And Cinta Gleska works to make sure that not only their staff, but their partners throughout the system understand these dynamics that we've been talking about. It's the integration rather than the separation of services, not drawing artificial boundaries, working together to break the cycle of violence and trauma, using culture as a strength and the most important resource for wellness. So whether it is the program offering services to children who have experienced trauma, or helping the child welfare department try to be more trauma-informed, to build the connection between the programs. Recently, with the interview with Julie Skinner from Cherokee Nation, Julie described to us the important work they're doing in building that connection between their system of care and their child welfare department, building the awareness of trauma and providing services for children and families who are in their child welfare system. So the timing, we just hit an hour. We have plenty of time left for questions, for thoughts, for comments. Any reactions to the things that I said, please type them in your chat box, and we'll have some time for discussions. We have some people typing. It must be a long one. That's good. There we go. Well, I have some other thoughts and comments, maybe some examples. Sabrina says, I'm thankful for this new model. The removal of Native children has been an issue for so long. Thank you. Well, it's true. And unfortunately, we learn to run programs in the image of the outsiders that have done this in damaging ways. Janice says, I'm glad you stated that trauma can be healed. Yeah, I think that's one of the most important messages that we have, and relating that back to Sabrina's comment about this has been an issue for so long. We have, the system has, as child welfare as we know it, has perpetuated that trauma by not acknowledging it and by making it worse through separations. That one of those adverse childhood experiences is the loss of one or both parents. There's no loss that's more profound than being taken out of your home, especially if that removal is not necessary, if it's based on racial discrimination or implicit bias. Those are extremely damaging situations. I'm going to talk a little bit about this issue of how trauma can be healed. Well, and I'll come back to that. Rose says, I think you're correct that child welfare needs to respond to trauma of removal for children and parents. We spend a great deal of time worrying about placements and leave moms alone in the house without their kids. We need to change our approach. Yes, and one of the interesting things to me is that we hear all of these arguments after a child has been in placement with a foster home about their bonding and attachment to the foster parent. Well, if we worried half as much about that issue of attachment and bonding when we were in the process of removal, we wouldn't remove kids nearly as often as we do. So I think changing that focus is really important. So with regard to the healing, one of the things that I didn't mention about the studies on adverse childhood experiences, there are now studies, including the NICWA study that I mentioned, that have identified child protective factors. So protective childhood experiences, relationships with caring adults, having a life that's connected with spirituality, whether that's Christianity or a traditional form, having a strong cultural identity, a strong cultural continuity in your community, knowing your own tribal language. All of those have been identified as protective factors. And as a matter of fact, in our study, several of those factors cut the impact of adverse experiences almost in half. So it is so essential for young people, Rose's example that we gave of having culture be the resource for helping and healing. I once had this explained to me. Some of you might be interested in a small book, I think it was commissioned by the Kellogg Foundation, and it's called The General Theory of Love. There's a chapter on brain development, brain chemistry, and trauma. It points out that the same part of the brain that stores trauma is the same part of the brain that stores love, compassion, trust, and caring. And it is possible, and not only possible, but clearly documented, that by building up a person's experiences of relationships that are trustworthy, of service to others, of compassion, of gratitude, of generosity, of humility, of respect, that all of those cultural teachings get stored in the same part of our brain as safe emotional states that can counterbalance the clusters of neurons associated with trauma. Now, they're clear in their book that those clusters of neurons related to trauma stay there until we stop using them. And the way the brain development works is what you don't use, you lose. So the idea is you build up those clusters of neurons in your brain associated with trust and love and relationship. And the things associated with trauma will begin to atrophy. And we can see that in the data of the studies where kids who get lots of parental support, who have relationships with grandparents or with elders and with their culture, those strengths, those things that they're associated with, having positive peer groups and many others, begin to overcome the trauma in their lives. This is not something without hope. As a matter of fact, there's lots of promise, and the more we can help young people have the experiences, like I think one of the most take whether it's canoe journey up in Lummi or community gatherings with Chalra at YKHC, or equine-assisted therapy at Santa Glasgow, or at the in the Southwest. There's a couple of locations. These are all examples of how culture is being used to mitigate the power of these adverse childhood experiences, bringing the promise of hope to our young people and to our families. Any other questions? Any other thoughts about this work? Sabrina says, yes, it's important to foster positive cultural image where there's so many stereotypes, for example, mascots. Yes, one of the things that's so important is that the adverse childhood experiences are not just experiences that are handed down inside of families. Somebody mentioned earlier that a safe child is a child who doesn't experience bullying. Well, bullying includes racial discrimination. It includes taunting about one's heritage and ridicule and stereotyping. And those images, those negative images, are pervasive in our culture. I saw a study recently that said the average American is exposed to 7 negative stereotypes about American Indian people every day, and we don't even know it, don't even see it. And so we have to help our children fight that off, because being the object of discrimination and racism is one of the adverse childhood experiences. It's equivalent to bullying. Any other comments or thoughts? Well, this is, we're getting ready to publish a newsletter on this topic, and helping what we hope to do is to really summarize this historic and collective trauma ACE-generating cycle as the challenge for tribal child welfare and children's mental health to work together on to solve. And I'm hoping that this has been a valuable discussion, and we will make sure that everybody gets the information about the newsletter when it comes out in a few months. So we're still in the writing process. Any last comments, questions? We have about 15 minutes. Amanda says thank you, and thank you for all the great work we do at NICWA. Well, we're pleased to be here doing it. Our NICWA's mission is dedicated to the well-being of American Indian Alaska Native children and their families. And we like to think that we're part of that healing process. So, and all of our members and all of the people who we work with in communities. So, let's see. Tamara says, "Thank you for the webinar. I work with schools and social work Title IV programs in California. Is there an integrating historical trauma into curriculum there's one message we would like social work students to have, what would it be? I think the most important message for us to make sure that students in schools of social work get is those touchstones of hope. It's a great resource to understand that the social work practices that people learn in the mainstream are developed by and for the mainstream American culture that has a different worldview and a different set of values than our communities. And when you take that and apply that in our tribal communities, there's major risk of doing harm. Keep in mind that for the most part, people who have provided services that have been harmful came to our communities in goodwill trying to help. So that's why my comment earlier about no solution imposed from outside based on a different set of values and conditions is going to serve our communities well. So thank you, Tamara, for the question about educating our social work students. And any of you who are doing this work and doing great work, I encourage you to take graduate students from schools of social work and teach them about Indian country and how what it means in your tribe to be a happy, healthy, and whole individual tribal member in your tribe. So again, I think if there are no further questions, so Tristan is typing. Thank you, Tristan. Multiple attendees are typing. Tamara says, I will share this. And Rose says, thank you for your time as we try to improve child welfare in Manitoba, Canada. Cool. I've been able to talk with people in Canada a lot lately. Good things happening up there. Melanie, thank you. And well, thank you for being on. Looks like Tristan is still typing. And I don't want to leave anybody out. Tristan. NICWA has student memberships as well, and Tristan can email anyone who's interested with information about student memberships to support their transition into the workforce. Terrific. Thanks, Tristan. We also should give a plug for our annual conference that's coming up in Anchorage, Alaska. Hope that people, and I think registration is just opening on our website. So Tristan, if you want to type in the dates and there's our website. Tamara says, I will include that information on my presentation to students. Great. Melanie says, proposals are due tomorrow to present at the NICWA conference. Yes, and please, if you're, we want to hear from you. We really rely on those of you who are doing great work in your communities, reinventing this thing called child welfare in a tribal image. So we're really pleased to have those. And we've had some really great presentations in the past from our system of care community. So we hope we have a great representation again.